Hello guys, I hope you're well. So today in this video we're discussing important points to remember in the exam. So for the upcoming GPC exam, what are things that you need to know? So let's start. So first and foremost, let's look at carbimazole carefully. So with carbimazole, as we've discussed already, it is used in hyperthyroidism. So this is a crucial point. And the dose you give for that is 15 to 40 milligrams daily until the patient becomes euthyroid. So usually after 4 to 8 weeks. So another important point that I want you guys to focus on is carbimazole 1 milligram is considered equivalent to propylthiouracil 10 milligrams. And that is a very, very crucial point to know. So the ratio is 1 to 10. But the dose may need adjusting according to response. So another important point is neutropenia and agranulocytosis. So the manufacturer advises of the importance of recognizing bone marrow suppression induced by carbimazole and the need to stop treatment promptly. So we've already sort of gone through these. Any signs of infection you would need to be wary of. So we've talked about a white blood cell should be performed, and if there is, so a WBC count is performed if there is any clinical evidence of infection, and that is a very, very, very crucial point. So also a few points I want to talk about with you guys today is I truly believe that the points that they're going to ask us in the exam is mainly going to be about electrolyte imbalances. So which drug can cause hyperglycemia? I expect you guys to know. So I'm asking you a question. Which medication can cause hyperglycemia? So a few drug families that can cause hyperglycemia is corticosteroids and thiazide diuretics. So indapamide, benzoyl, these all can cause hyperuricemia, hyperglycemia, and hyperkalemia. This is a very crucial point. You need to know the mnemonic of Thanks B. Thanks B are the medications that can cause hyperkalemia. So trimethoprim, heparins, ramipril, potassium-sparing diuretics, and these sorts of medications. The medications that can cause hypokalemia would be thiazide diuretics, loop diuretics, beta-2 agonists, corticosteroids, etc. So electrolyte imbalances is on the priority list according to El Teacher and you must know that. Knowing reference ranges is not important because in the exam they will give you the reference ranges. So they will tell you, they'll give you a table with the reference ranges and give you the changes in the electrolytes of the patient in the current moment. And these are a few points that I expect you guys to know. So back to sort of where we were. So we were just here. So we've already been through acute pancreatitis, and we've been through why acute pancreatitis is an important sort of ADR to look out for and how does it present. So acute pancreatitis will present with severe persistent abdominal discomfort, and that's something to look out for. However, I've seen past papers where the person has lower back pain. That is more of a red flag. So if lower back pain was in conjunction with severe abdominal discomfort and even vomiting, this is a crucial problem. Now, let's not forget the sad man rules or the sick day rules. So oftentimes, for example, you will see a patient scenario with a GLP-1 agonist and vomiting. So let's quickly go to the sick day rules and let's quickly have a look. So let's go to an official NHS source. So we're not looking at any AI-based sources. So this is Nottinghamshire Area Prescribing Committee. I'm referencing them right now. It's the NHS. And this is a publicly available file. So the SADMAN rules are classes of medications that should be temporarily stopped during intercurrent illness. So these are a non-exhaustive list of medications where you will need to halt it if you get a few symptoms. One of them being vomiting. So let's look at it. So SADMANs is SGLT2 inhibitors, any medication that ends in a glyphosin. ACE inhibitors, diuretics, such as loop diuretics, potassium diuretics, and benjoyfenone thiazide, metformin, standard release as well. Obviously, lactic acidosis is to look out for, and ARBs and NSAIDs orally. So we need to not forget with NSAIDs, they are avoided in severe heart failure. Now you may be asking, oh teacher, why? Now naturally, NSAIDs cause sodium and water retention, which will lead to a worsening of edema. The state of edema would be worse. So this is very, very important to look out for. So let's quickly go to NSAIDs. So let's go to diclofenac. So diclofenac is a very, very important medication, and with systemic use, cardiac impairment is a caution, and we have hypertension, and it may mask symptoms of infection. So sometimes when you're doing past papers, I've often seen questions about chickenpox. So can you give ibuprofen or NSAIDs to a person with chickenpox? Generally you can't, and why? Because it can mask the symptoms of infection, and also risk factors for cardiovascular events. So this is a very, very crucial topic to go through. Now, when you're revising, guys, naturally you'll be in a constant state of giving up, hopeless, then hopeful. This is normal, and everyone experiences this. So I don't want you guys to be like, oh, I'm revising, nothing's going into my head. You are not the only person that's experiencing this. Many people take this exam, around 1,000 plus people every year take this exam. You're not the only individual taking it. So just be persistent, keep studying, and keep going through stuff. If you feel like you revise better through watching videos on YouTube, do it. If you feel like you need to discuss things with friends and discuss topics, call your friends up. If you feel like you need to get a tutor, get a tutor. If you feel like you need a course, get a course. So do whatever works for you to pass this exam, if that makes sense. Now, so what other points do I feel like are important? Antipsychotics, which is part of CNS, is an extremely important point. So what do I think is important to focus on is second generation and first generation antipsychotics. So when you take antimuscarinics with antipsychotics, you will get something called neuroleptic malignant syndrome, abbreviated as NMS. So NMS is a movement disorder group of symptoms, and this happens especially when you give, for example, a TCA with antipsychotics, as TCAs are used for depression. However, they still have antimuscarinic properties. Tamsulosin is antimuscarinic, oxybutynin is a antimuscarinic as well. So watch out for that when you're studying as well. So let's look at NSAIDs further. So some side effects, obviously hypersensitivity to NSAIDs, that makes a lot of sense. Appetite decreased is a bit of an interesting one. So appetite decreased is with all uses, whether they're parental, rectal, oral, doesn't seem to have with topical use. So that, oh yeah, because it avoids first pass metabolism. So conjunctivitis, which is quite interesting, and that's NSAIDs for now. So I'm gonna keep this video short. I don't want to dwell on. I hope this video will help anyone out there, and if anyone has any suggestions of what to cover or any topics within the exam context, please DM me, message me, comment, like, do what you need to do. And as always, thank you so much, and take care of yourself.